Iceland is known for its rugged landscape, rich Viking history and progressive social politics. But the Nordic island nation has another lesser-known distinction. There is next to no one in its population with Down syndrome. According to the Icelandic government, just 2 or 3 children with Down syndrome are born on average every year. The explanation is reportedly high rates of prenatal testing, where almost all pregnancies where Down syndrome is diagnosed are terminated. Daryl Steff is the CEO of Down Syndrome Australia, and he joins us now from Brisbane. Daryl Steff, welcome. So how do you feel when you hear there is next to no one in Iceland being born with Down syndrome?
Thank you. Look, I do think it's an unfortunate outcome that the way that prenatal screening and testing has been delivered and approached in Iceland has created the perception that the testing is routine and that generally people perceive that there's only one outcome for a high chance result. It has been acknowledged in Iceland that the perception that has been created through that of what it means to get a high chance result and also what it means to have a child with Down syndrome is presented in a very negative way. And I guess that's our position at Down Syndrome Australia, is that that's not how it should be presented. Prospective parents do have a right to accurate information and quality support so that they can make an informed decision about prenatal screening, the results that they might get and where relevant, the future of their pregnancy.
And so what does a society lose when the number of people with Down syndrome gradually declines to zero?
Yeah, look, I think it's a hard question to answer. I mean, I think at a macro level, it goes towards narrowing the diversity that we have in our communities. Like our communities in general, regardless of people's abilities, disabilities, cultural backgrounds, etc., has part of the rich fabric of our communities is that diversity. And so it would be disappointing to see bits of that disappearing. I do think it's important to note that that's not something that we're currently facing here in Australia. In fact, the number of people with Down syndrome Australia has actually increased from less than 3,000 in the early 1950s to over 13,000 today, due to better healthcare, early intervention, etc. And obviously, prenatal testing has had an impact on those population numbers, but there are still a lot of people with Down syndrome living healthily and living really good lives in Australia at the moment. And I think it is relevant to note as well that, overwhelmingly people with Down syndrome consider themselves to have great lives, especially with, as I touched on, the improved healthcare, early interventions and support services such as the NDIS that are now available.
And so how do you feel about the existence of this pregnancy test to determine if a fetus has Down syndrome?
Yeah, I don't have a problem with the fact that there is that test. I think that's part of what we do as a society in terms of the medical advancements we make. I think the key though is in how those tests are delivered and ensuring that there is informed choice for people undergoing that test. Prospective parents have the right to accurate information and quality support to make an informed decision about prenatal screening, about any results they might get from prenatal screening, and if necessary, the future of their pregnancy. Unfortunately, what we hear too often is that when a high chance result is delivered, it's delivered in a negative way. Often we've got statistics of hearing over 50% of people receiving a high chance result then feel pressured towards termination. And the way that those messages are delivered and the way that the prenatal testing is delivered are things that remain with prospective parents for decades, and it's been shown to profoundly shape their experiences. So I think it's important that the message is delivered in the right way. I think it's been shown that medical professionals, some research was done by the University of Queensland last year, where medical professionals said that half of them don't feel fully equipped to deliver the results of a high chance result from prenatal screening. So there does need to be better training around that. There needs to be up-to-date information in accessible formats using neutral language to understand the screening. And obviously up-to-date and objective information about Down syndrome and what it looks like these days to live with Down syndrome, and the opportunity to connect with families and to understand that.
And what's the anecdotal evidence that you've come across with the people you know about how that process is handled in Australia?
Yeah, look, as I touched on, unfortunately, a lot of the information we hear is that it's still not always done in the best way. There's been statistics that show that over 60% of obstetric providers, for example, deliver the diagnosis as an apology or as bad news. And I think some of those negative ways in which messages are delivered are created by prejudice or bias or fears that might be in there. And we've done a lot of work, particularly in Queensland, with Queensland Health and our Down Syndrome Queensland, developing a prenatal screening website and resources both for healthcare professionals and prospective parents. And Queensland Health have actually developed a clinical guideline as to how this process should operate. But the piece that's lacking is the communication of that amongst healthcare professionals, and to give healthcare professionals the time and the opportunity to explain what prenatal screening is appropriately to prospective parents. Often it's done, in a 10 or 15 minute GP appointment alongside everything else that a GP is trying to communicate around pregnancy and how to look after yourself, etc. So there needs to be a better focus in making sure that there's that informed consent with up-to-date, accurate information, and that's what we're trying to ensure.
And Daryl, what's your message to parents presented with this decision after getting test results?
Yeah, look, if the process was working properly, then ideally the prospective parents, if they do receive a high chance result, they would have already had the opportunity to think how they might deal with that result. Unfortunately, as I've touched on, that's not always the case. So what I would be encouraging parents to do is to take the time and to make sure that they've got all the information that they need to be able to make the decision that's right for them. And we completely acknowledge that is an individual decision based on personal values, circumstances, and a whole suite of things that are very personal to an individual. But make sure you're doing that with informed choice. And if you need extra information, reach out to organisations such as Down Syndrome Australia. Reach out to your healthcare professionals, but don't be pressured into anything, and don't consider that there's only one option if you do receive that high chance result.